So you did it. Illinois is being touted across the country of getting it right. If you weren't originally sure that staying at home and masking and physical distancing and washing your hands helps slow disease transmission, hopefully you're a believer now. We have seen declining fatality totals week after week for 5+ weeks, along with our declining numbers of admissions to the hospitals. And you did it with those 3 W's: washing your hands, wearing your face covering, and watching your distance. Should have worn my cheerleading outfit to celebrate and cheer, but now I want to tell you that there still is a reality check behind that. The virus has not been eradicated. The virus persists, and we don't yet have a vaccine or a highly effective treatment that's widely available. So although we are seeing fewer and fewer cases, fewer deaths, people are still being infected and people are still losing their lives. But as the numbers say, since yesterday, we did report 894 people who were newly diagnosed with COVID-19, which brought our statewide total to 139,434 cases. And as the governor reported, that included 41 additional fatalities, for a total of 6,810 lives lost from Illinois. As of last night, 1,626 people are in the hospital with COVID-19 illness. Of those, 399 patients are in the ICU and 216 are on ventilators. An important part of the goal is to increase testing capacity throughout the state. To date, well over 1 million tests have been run, with, again, as the governor mentioned, 31,686 being reported in the last 24 hours, an important milestone of crossing 30,000. We are trying to get back to our normal lives. We are going to coexist with COVID. There's a deal, a social contract, if you will. Government officials, including public health leaders, we have the responsibility to gather the best available data and the best available science and share that information with everyone. And in turn, the public's part is to follow those recommendations, which will help keep individuals and entire communities safe. To help the public make these informed choices, we are launching a special new tool on the IDPH website that shows people if their county is staying on track. Our incredible IDPH team, along with amazing collaboration from our local health departments, have created a map that shows each county in the state and whether it's meeting target indicators or if there's a reason for some caution. Those indicators include the number of new cases over the last week, test positivity, emergency department visits, and hospital admissions for COVID-like illness. As well, we're looking at the number of deaths and the percent of ICU beds available in the area. The percentage of cases that are part of a cluster and the amount of testing that's been done in your county are also taken into consideration. All of these indicators will be on the website. I think they're up now, and the map will easily show you the status of your county and any other county you're interested in. If your county is colored blue, we're on the right track. If your county is colored orange, that's a caution or a warning that something is going on. And our goal is that with that caution, you will think twice about your own personal habits and activities. Maybe you'll think about reconsidering going out in that large group gathering. Maybe you'll reconsider going to an indoor dining experience. Maybe you'll consider appreciating a religious gathering online as opposed to in person. These county level risk indicators do not necessarily mean that a county moves back. What it means is that if the numbers don't improve, we could be headed in the wrong direction. But of course, as you have seen, individual actions are so powerful, and so that is your signal to take action. As we open a lot of our state, the motto is to start low and go slow. Yes, we are all excited to open, but we're opening with limited capacity. We want to be able to measure the effects and then increase capacity as the data tells us that, yeah, we're good. We have gone so far along this right path, so I'm imploring everyone to continue with us in a deliberate manner. We've seen individuals contract the virus after attending wedding celebrations, church gatherings. We've also seen hair salons with what turned out to be infected stylists, but with everyone masked and covered, no customers were reported to get infected. The power still remains in all of our hands. I know it's summertime and it's a time to travel and to congregate. We want to chillax. We're coming up on an important holiday, our 4th of July, a day traditionally marked by picnics and parades and other patriotic events. Just a word of caution. Large crowds, of course, do increase your risk of exposure to the virus. It's still a risky endeavor. If you say, well, Dr. Ezike, you said that we slowed transmission and there are fewer and fewer infections, it should be safer now. I would say, yes, you're right. But because the virus is still out there, we still have to remember the things that got us to this good situation so that we can continue to safely coexist with COVID. Maybe we need to get cozy with COVID because it looks like this virus might not be leaving us anytime soon. So let's continue to do the things that will help us mitigate the risk. At the risk of sounding like a broken record, please continue to follow the 3 W's. Wash your hands, wear a face covering, watch your distance. We all know that that means at least 6 feet between you and the next person. And as part of this social contract, if you have any symptoms of illness, if you have a fever, shortness of breath, please don't go out in public. Please don't dine in a public place. Please don't gather with your friends. Let's take care of our fellow Illinoisans. Let's be respectful of each other. Please stay home if you're sick at all. Remember, we can still spread the virus before we even know we're infected. I can't ignore those voicing opposition to face coverings. You are still part of this contract too. I have to talk specifically to you. Your individual actions or even your inactions will still affect everyone in this state. I'm likening the refusal to wear face coverings to a game of Russian roulette, as we don't know who's infected, we don't know if we are infected, we're just taking a chance. This game of Ruskaya Ruletka is a game that is very risky. The stakes are high. It's potentially fatal. Let's not gamble with coronavirus. We don't even know the long-term effects of having COVID-19. What might happen to our lungs 5, 10, 20 years from now after being infected? There's nobody that can answer that question right now. So if we can prevent catching this dangerous virus, we should try our best to do so. The thing that has made the difference now and the thing that will continue to make the difference is you and your behavior. So please, let's continue to use our common sense. Let's be safe. Let's use the 3 W's to protect ourselves and our entire communities. Thank you so much for joining in this important effort. And now a summary in Spanish.